Okay, today the theme of our lectures, that is a pharmaceutical care for the dispensing of the OTC drugs. What plan of our lecture? That is the over-the-counter drugs, need to the proposed rules, anticides products, anti-flatulent products, antiseptic drugs, topical antifungal drug, topical acne drugs products for the counter human use, laxative drugs, antiemetic drugs, nighttime sleep aid drug, cold, cough, allergy, and bronchodilatator and antiasthmatic drugs, internal analgesic, antipyretic, and anti-rheumatic drug, and topical otic drug, anorectal drug products, skin protectant, external analgesic, ophthalmic drugs, and antiperspirant drug. Well, for the first, government agencies regulate over-the-counter drugs to ensure they are safe and effective when used as directed. Over-the-counter medications are available to consumers without a prescription and can be used safely and effectively without medical supervision. Over-the-counter medications have long provided patients with an effective and inexpensive way to meet their daily healthcare needs, and they are playing an increasingly important roles in the healthcare system. Over-the-counter medications include medications for the allergies, pain, fever, and many other indications. Over-the-counter medications can be purchased from many online retails and retail outlets, including pharmacies, grocery stores, and convention stores. Regulators recognize the potential benefits of providing consumers with access to additional type to over-the-counter medications, such as some medications that is currently only available by prescription. Currently, over-the-counter medicine are limited to medicines with the labeling may provide sufficient information to enable consumers to independently select and use the medicine. For some drugs, labeling restrictions pose challenges to adequately communications the information consumers need to make appropriate self-selections or use of the drug without the supervision of the health care provider. Over-the-counter drugs with the additional conditions for non-prescription use, ACNU, under the proposed rule, when labeling alone is insufficient to ensure that consumer can properly select to use or both correctly, and over-the-counter drug products, an applicant may submit an applications proposing in the ACNU that the consumer must successfully meet the conditions to obtain an over-the-counter drugs with ACNU. Antacid group, very popular group of the drugs for using as an over-the-counter drug. Aluminum containing active ingredients: basic aluminum carbonate gel, aluminum hydroxide, that is the dihydroxyaluminium amino acetates of dihydroxyaluminium amino acetic acid. Aluminum phosphate gel when used as a part of the antacid combinations product, and contributions at least 25% of the total acid neutralization capacity. Maximum daily dosage limit as 8 grams. Dihydroxyaluminium sodium carbonate. When we prescribe, when we recommend these drugs for the patients, when the patient has the burn, a very intensive pain in the stomach, this patient has the very low level of the pH, high level of the acidity. For example, the gastritis, maybe sometimes the symptoms of the gastrinoma, when the patient has the high level concentrations of the gastrin, and we must stop of the very high level acidity for the stopping of the destroying of the mucus of the stomach of our patients. For example, aluminum hydroxide gel, aluminum phosphate gel. Next group, that is the bicarbonate containing active ingredients. Bicarbonate ion, maximum daily dosage limit the 200 microequivalent for the person up to the 60 years old and 100 microequivalent for person 60 years or older. Bismuth contain active ingredients. What is it? That is the bismuth aluminate, carbonate, subcarbonate, subgelate, and subnitrate. For example, that is the bismuth aluminate, that is the bismuth nitrate and bismuth carbonate for the stopping of the high-level acidity in the stomach. Calcium contain active ingredient. For example, calcium is a carbonate or phosphate. Maximum daily dose limit 160 microequivalent calcium. Practically, this is the 8 grams calcium carbonate. Citrate containing active ingredient. Citrate ion as a citric acid or salt. Maximum daily dose limit the 8 grams. Glycine, amino acetic acid, magnesium containing active ingredients that are ghydrate magnesium aluminate activate sulfate, maltodextrate, magnesium aluminosalicylate, carbonate, glycinate, hydroxide, oxide, and trisalicylate. For example, glycine, that is the simeticone, magnesium glycinate, for the using for the patients with the stomach problems. Phosphate containing active ingredients, aluminum phosphate, mono or dibasic calcium salt, 3 calcium phosphate, maximum daily dose 24 gram, monocalcium phosphate, beta tricalcium phosphate. For example, potassium bicarbonate. Another antacid product, sodium contain active ingredient, sodium bicarbonate or carbonate when used as a component of the effectiveness preparation. Maximum daily dose limit the 200 microequivalent or sodium for persons up to the 60 years old and 100 microequivalent of sodium for persons 60 years or old and 200 microequivalent or bicarbonate ion for person up to the 60 years old and 100 microequivalent of bicarbonate ion for person 60 years or older. Sodium potassium titrate. And we must remember about the group of the salicylides. That is the magnesium aminosalicylides, magnesium trisalicylides. Tartrate containing active ingredients, for example, tartaric acid of its salts, maximum daily dose, limit 200 microequivalents, 15 grams of titrate. Tartaric acid or magnesium trisalicylates mixture. Very important information about the drugs which we use for as antacid treatments. We must remember, sometimes the patient has the serious difficult gastritis, for example, Helicobacter positive gastritis. And this bacteria can induce the disorders of the mucus of the stomach and sometimes induce the cancer of our patients. That's why we recommend it, if the patients long time use this antacid therapy, we recommend it, and maybe you in the future recommend it to these patients, please go to the doctors for the verifications of the etiological factors. And maybe these patients need the more aggressive, more effective treatments. For example, hyperacidic Helicobacter positive gastritis. In these situations, we must prescribe inhibitors of the proton pump. Lansoprazole, rabeprazole, Pariet, omeprazole, and other, together with the antibacterial drugs, for example, amoxicillin, Denol, metronidazole, and others. And during the 7 to 10 days, we can eliminate this bacteria and prevent of the progression this gastritis to the cancer and another complications, sometimes penetrations, perforations, bleeding to the stomach of these patients. Another problems after the long time using of the antacid therapy, that is the increasing, if that is the the calcium antacids, the long time using of these drugs sometimes provocate of the hypercalcemia. Why that is the problems? These situations when the patient has the increasing of the concentrations of the calcium in the blood, these situations can provocate of the increasing of the blood pressure first. Second, the organism want to remove the calcium ionum over concentrations of the calcium ionum from the organism per kidneys and per bile tracts. And what we see in these situations, we see the stones in the gallbladder together with the stones in the kidneys. There is a serious side effects after the long time using uncontrolled using of the calcium antacid drugs. And for example, if the patients contain the aluminum if the drugs contain the aluminum can provocate the problems with the central nervous systems and kidneys. That's why if you see the long time using, usually this patient has the very difficult constipations. There is a problems for the patient. Sometimes the situations provocate the colitis. That's why if you will see these patients, recommended, please go to the gastroenterologist, maybe family doctors, for the verifications of your gastritis etiology. Sometimes that is a tumor. Sometimes it is a tumor, not only the ventriculus, the stomach. That is the problems of the pancreas. Why? Because the pancreas can produce the high-level concentrations of the gastrin. This hormone induce of the activity of the mucus of the stomach and increase the acidity and decrease of the pH in the stomach. And the patients feel the pain, feel the burn, and use long time antacid. That is the very, very serious problems. That's why if that is the short using, no problem. But if that is a long time using, that is the please recommend your patients the consultations of the, for example, of family doctors, of gastroenterologists. Okay, antiflatulent products for over-the-counter human use. Simeticone, maximum daily dose, the 500 milligram. The labeling of the products provided to the health professionals, but not the general public, may contain the additional indications post-operative gas pain or for use in endoscopic examinations. Professional labeling for the antiflatulent antacid combinations may contain information allowed the health professionals for antacid and antiflatulent. For example, simeticone antiflatulent, 80 grams, on sometimes combinations of the simeticone with the alumina, magnesia suspensions for the antiflatulent effect, antacid plus antiflatulent effect. Antiseptic drugs products for the over-counter human use. Alcohol to the 95% by volume and acquires the solutions denaturate according to the Bureau in this of regulations of the drugs. Benzalkonium, that is the compared the metacresol, camphorated phenol, that is the eucalyptol, hexasorcinol. For example, that is the ethyl alcohol. Spiritus, that is the, for example, benzalcoholium chloride and eucalyptol terpene. Antiflatulent products for over-the-counter first aid drugs, maybe that is the antiseptics drugs products. Hydrogen peroxide, typical solutions, iodine tincture, iodine topical solutions, isopropyl alcohol, menthol, methylbenzalkonium, methyl salicylate, phenol, and povidone iodine. That is the antiseptic drugs products. For example, hydrogen peroxide, we must to protect these drugs from the insolations, because after the effect of sun to these drugs, be particularly it can destroy these drugs and provocate the absolutely ineffectiveness, antiseptic effect of these remedies. Iodine tincture, for example, povidone iodine solution. In Ukraine, for example, we use the diodicirin. Diodicirin, very interesting drugs. That is the combinations of the iodine, that is the glycerin, and dimixid. Dimixid provides the moving iodine ion to the maybe 2-3 millicentimeters from the skin to the, for example, joints, to the subskin fat and other, for the stopping of the bacterial growth, because this dimixid sulfoxide provide the moving of the iodine ionum into the tissues of our patients. We like these drugs. Okay, antifungal drugs. The active ingredients of the products consist of any one of the following with the specific concentrations established for each ingredient. That is the cleohenol, that is the galoprogen, miconazole nitrate, providone iodine, tolnaftan, undercyclinic acid, and clotrimazole. For example, cream of the chlorhinol, that is the clotrimazole cream, miconazole nitrate. We know that is the only local the effect provide these drugs, but sometimes after the long time using of these drugs, clotrimazole or another antifungal drugs can move to the blood and provocate what? That is the very aggressive of inhibitors of the CYP3A4. And after the time using very big dose or parenteral using of them or peroral using of the antifungal drugs, these drugs can provocate of the stopping of the effectiveness of working of the CYP3A4 and increasing the concentrations of the another drugs, and over concentrations provocate of the side effects. We must remember of these side effects of this group. Topical acne, the active ingredients of the product consist of any of the following. That is the benzoyl peroxide, resveratrol monoacetate, salicylate acid, sulfur to the 8% when combined with the resveratrol or resveratrol monoacetate. Without the combinations, the sulfur can sometimes could be the 10% of concentrations of these drugs. For example, that is the benzoyl peroxide, 10% acne medications wash, resveratrol, and for example, salicylic acid solution for external using of our patients. Laxative drugs, productions of the over-counter human use. Bulk forming laxative active ingredients, bran, cellulose semi-synthetic ingredients, methyl cellulose, sodium carboxymethyl cellulose, caraya, melt soap extract, and polycarbophil. For example, metacell, methyl cellulose, that is the carboxymethyl cellulose sodium for using. Psyllium ingredients except those, that is the plantago ovata husks, plantago seed, psyllium hemicellulose, psyllium hydrophilic mucilode, psyllium seed, husk, and bulk forming laxative active ingredients, glycerin and sorbitol. Herbal fat supplement and refined glycerin. But if the patient's long time has the constipations from the real clinical practice, after the verifications of the problems with the gastrointestinal tract, we recommend to the doctors and pharmacists, please, maybe this patient has the symptoms of the low level concentrations of the T3, T4. That is the hypothyroidism, decreasing of the concentrations of the thyroid hormone. Why? Because if the patient has the deficiency of the euthyrox-levothyroxine, long time, sometimes the patients use their drugs for the treatments, these constipations. But after the verifications, the low level of the T3, T4, and high level of the TSH, we understand that is the deficiency of the functions of the thyroid gland. Usually that is the autoimmune results of the autoimmune thyroiditis Hashimoto, and autoimmune process destroyed of the thyroid gland. And usually that is the combinations, not only the constipations. Usually that is the edema of the face, that is the bradycardia, hypotonia, iron deficiency, anemia. The patient has the decreasing of the memory, hair loss. That is the combinations. We think maybe that is the deficiency of the T3, T4, and only replacement therapy, euthyrox-levothyroxine, provide the very effective effect to these patients. That's why if your patients will have used long time without the consultations of the doctors using of the laxative drugs, please send these patients to the gastroenterological specialized for the verifications, or sometimes endocrinological specialized for the verifications of these problems. Antiemetic drugs, for example, cyclizine hydrochloride, dimenhydronate, diphenylhydramine hydrochloride, meclizine hydrochloride. For example, cyclizine hydrochloride, we can use meclizine hydrochloride tablets, 25 milligram in one tablet. Nighttime sleep aid, diphenylhydramine hydrochloride, diphenylhydramine citrate. Well, for example, these drugs, 25 milligram, we use for treatments of our patient. Cold cough, allergy, bronchodilators, and anti-asthmatic drugs. For the first, that is the antihistamine active ingredients, that is the brompheniramine maleate, chlorcyclizine hydrochloride, chlorpheniramine maleate, dexabrompheniramine, doxylamine succinate, pyrilamine maleate, tronzilamine, and others. Well, for example, brompheniramine maleate we can use in these clinical situations, doxylamine succinate together with the pyridoxine hydrochloride and folioacidic tablets. Well, pyridoxine, that is the B6 vitamin, and folioacidic, that is the B9 vitamin for using for our patient. Antitissue active ingredient, oral antitissue, so that is the clopidogrel hydrochloride, codeine ingredients, codeine phosphate, codeine sulfates, dextrometaphorphan, dextrometaphorphan, hydrobromide, diphenhydramine citrate, diphenhydramine hydrochloride, and topical antitissues, that is the camphor and menthol. For example, codeine phosphate, that is the anti-cough effectiveness, but practically in real clinical practice, we don't recommend it because these drugs sometimes provocate problems with the central nervous system. So camphor oil possible is a plant drugs. Bronchodilators active ingredients. The active ingredients of the products consist of any of the following when used within the dosage limits established for each ingredient: ephedrine, ephedrine hydrochloride, ephedrine sulfate, epinephrine, epinephrine bitartrate, racephedrine hydrochloride, raceepinephrine hydrochloride. For example, that is the ephedrine hydrochloride, raceepinephrine. And for example, sometimes for the emergency health for our patients, for example, emergency aggressive status asthmaticus, allergic reactions as a practically anaphylactic reactions. In these situations, we like to use the EpiPen recommended for these patients. Practically all patients who had in anamnesis any anaphylactic, difficult, severe reactions, all time, all life, practically safe in the pocket, this EpiPen pack for the emergency help when the patient has the allergic reactions, anaphylactic reactions of bronchial asthma status. Nasal decongestant active ingredients. The active ingredients of the products consist of any following when the use with the dosage limit and a dosage from the established for the each ingredient. Oral nasal decongestant, that is the phenylephrine hydrochloride, that is the pseudoephedrine hydrochloride, pseudoephedrine sulfate, phenylephrine biotartrate, and the effectiveness dosage form, and topical nasal decongestant. What is it? That is the lev methamphetamine, ephedrine, ephedrine hydrochloride, ephedrine sulfate, nafazoline, oxymetazoles, phenylephrine, polyoxidrine, and xylomethazine hydrochloride. There is sometimes there is a combinations of some drugs, for example, phenylephrine hydrochloride plus chlorpheniramine maleate plus paracetamol. There is a suspension for the cold fever and practical inflammation syndrome. That is the nafazoline hydrochloride for the internal organs. Analgesic antipyretic active ingredients, that is acetaminophen, aspirin, buffered aspirin, carbaspirin, choline salicylate, magnesium salicylate, sodium salicylate. You remember about the acetaminophen without the aspirin, yes? For example, we must remember the aspirin absolutely contraindicate for the children before the 12 years. And why? Because the Reye syndrome can produce the progressions of the destroying of the brain and liver of these patients, young patients. That's why absolutely contraindications for using of aspirin in tetracycline group for the children, absolutely no. Ray syndrome. But very popular drugs for stopping of the fever and another problems, it is the paracetamol in children period. But we must remember that paracetamol sometimes induce the toxic hepatitis for our patients. That's why if the patients had in anamnesis the problems of the liver, don't recommend the paracetamol for these patients. Now, for example, the another variant, which is the magnesium salicylate tetrahydrate, pain reliever, non-steroidal anti-inflammatory drugs, we can prescribe for patients with the pain and inflammation. Permitted combinations of active ingredients, combinations of acetaminophen with the other analgesic antipyretic active ingredients, aspirin, carb, aspirin, calcium, choline, magnesium salicylate, sodium salicylate. Now, for example, for the local effect, we can use the local mouth ulcer gel, which drugs include the choline salicylate, benzalkonium chloride, and ethanol. Airwax removal and active ingredient. The active ingredients of the products consist of the carbamide peroxide, 6.5% formulated as an anhydrous glycerin vehicle. Ear drying aid active ingredient. The active ingredient of the products consists of the isopropyl alcohol, 95% is an anhydrous glycerin 5% base. For example, these combinations, carbamide peroxide, we can use as ear drops. Local anesthetic active ingredients. The active ingredients for the products consist of any of the following when use of the concentrations of within of the concentrations range established for each ingredient. Benzocaine, benzyl alcohol, dubicaine, dubicaine hydrochloride, diclonine hydrochloride, lidocaine, pramaxine hydrochloride, tetracaine, tetracaine hydrochloride. For example, benzocaine hydrochloride, lidocaine, tetracaine hydrochloride. You must remember about the lidocaine using in the organism. That is not only local anesthetic. We can use these drugs as intravenous injections for the antiarrhythmic effect when the patient has the very dangerous ventricular arrhythmia. In your Croc 2 questions, you will have the questions about the lidocaine. Can we add the lidocaine to the ceftriaxone for the intramuscular injection? Yes, the absolutely normal combinations, the ceftriaxone together with the lidocaine for the intramuscular injections. Why? Because without the local anesthetic, ceftriaxone provides the very, very intensive pain during the intramuscular injections and a long time after these injections. You can find the absolutely useful information in the instructions of the ceftriaxone. Please add to the 1 gram of the ceftriaxone 5 milliliters of the 1% of the lidocaine for the prevention of the local pain. But you have another questions to the Croc 2 about the very extremal situations, anaphylactic shock after the use of the lidocaine. You must remember, for the first 1-2 milliliters of the adrenaline epinephrine is intramuscular injections, and later intravenous injections, 5-6 milliliters of the prednisone. 1 milliliter of the prednisone contain the 80 milligram of prednisone, or 5-6 milliliters of the dexamethasone. 1 milliliter of the dexamethasone contain the 4 milligram of these drugs. No, that is the emergency situations, and local anesthetic sometimes can provocate these side effects. And another local anesthetic, tetracaine hydrochloride, ophthalmic solution, sterile for the local anesthetic effect. Vasoconstrictive active ingredients, that is the active ingredients of the product consist of any of the following when used the concentrations of within the concentrations range, that is the ephedrine sulfate, epinephrine, epinephrine hydrochloride, and pleniphenylpherine hydrochloride. No, for example, ephedrine sulfate, and for example, that is the phenylepinephrine hydrochloride, 0.5% nasal decongestant. The following active ingredient may be used on the sole protectant active ingredient of the product, so the ingredient of the identified, there constitutes the 50% of more by weight of the final products. Aluminum hydroxide gel, cocoa butter, glycerin, for example, hard fat, kaolin, lanolin, mineral oil, petrolatum, topical starch, white petrolatum. For example, cocoa butter, we can use lanolin cream, or for example, the white petrolatum as a skin protection. Analgesic, anesthetic, and antipruritical active ingredients. The active ingredients of the product consist of any of the following when used within the concentrations range established for each ingredient: camphor, juniper, menthol. For example, that is the juniper tar, that is the camphor oil, and astringent active ingredients, that is the active ingredients of the products consist of any of all following when they use within the concentrations range established for the each ingredient: calamine with the concentrations range of 5 to 25% by weight per dosage, witch hazel, zinc oxide within the concentrations range of 5 to 25% by weight per dosage unit. For example, that is the witch hazel, natural astringent, zinc oxide ointment, galamine plus salicylic acid. Catalytical active ingredients. The active ingredients of the products consist of any of the following when used within the concentrations range established for each ingredient: cloxa and resveratrol. Resveratrol skin fill and skin neutralizer. The skin protectant drug products, that is the active ingredients: allantoin, aluminum hydroxide, calamine, cacao, cod live oil, colloidal ointment, dimethicone, glycerin, hard fat, kaolin, lanolin, mineral oil, petrolatum, the lanolin, sodium bicarbonate, talc, topical starch, white petrolatum, zinc acetate, zinc carbonate, zinc oxide in different concentration. For example, urea plus allantoin provide the hair smoothness, cod liver oil, and zinc oxide ointment. Skin protectant. External analgesic drugs productions, that is analgesic anesthetic, amine and cane topic, benzocaine, butabmen, dibucaine, dimethylsoquine, diclonine, lidocaine, paramoxine, tetracaine, hydrochloride. For example, benzocaine, and for example, diclonine hydrochloride topical solution, 0.5%, topical anesthetic. External analgesic, another group drug productions of the over-the-counter human use, that is the alcohol, all ketones, benzyl alcohol, camphor, camphorated metacresol, juniper tar, menthol, phenol, and phenolate sodium and resveratrol. For example, creatine, we can propose for our patients resveratrol for external use. Antihistamines, diphenylhydramine hydrochloride, tripentamine hydrochloride, hydrocortisone preparation, hydrocortisone different concentrations, male genital desensitizers, for example, we can prescribe benzocaine, lidocaine as a meteorite spray with approximately 10 milligrams per spray. For example, diphenylhydramine, savintol hydrocortisone, and omeprazole, benzocaine. Counter-irritant active ingredients for external effective. The active ingredients of the products consist of any following with established concentrations for each ingredient not for use as a patch, plaster, and poultice dosage form. Irritants that produce redness, there is the allyl isothiocyanate, Strong ammonia solutions dilated to the contain to 1 to 22.5 ammonia, methyl salicylate, terpentine, irritants that produce the choline sensizations, that is the camphor, exceeding, menthol, irritants that produce vasodilatations, that is the histamine dihydrochloride, methyl nicotinamide, irritants that don't produce redness, that is the capsaicin, capsicum contain the maybe 0.025 to 0.25% capsaicin, and capsaicin or olerizin variant of these drugs. Terpentine, for example, oil we can use, or for example, camphor spiritus. Thank you for your attention. Thank you.